Doctor, can you talk about that and the reemergence of measles in Venezuela?
Sure. Yes. In Venezuela, as you mentioned, circulation of wild measles was interrupted in February 2007. This after a mass vaccination campaign that followed the 2001 and 2006 outbreaks. Since Feb 2007, measles transmission was actually interrupted, and we haven't had a measles case reported to date. However, 2017 was when measles reemerged in Venezuela, and this happened particularly within vulnerable indigenous populations down south in the Guayana Shield and the Amazon basin. And it basically had its origins due to a massive migration of people who had lost their jobs, and that coincided with the drop in oil prices and the government installing what is known as the Orinoco mining arc. This is basically a melting pot of illegal mining and guerrilla and violence and anarchy in the extraction of gold. So this actually brought infected migrants from Brazil and from other parts of the world, and basically that was the hotspot that originated the measles crisis. So from the mining camps in Bolivar is where measles started spreading throughout the country. As for October 2018, Venezuela had contributed with 68% of the measles cases reported in the Americas, and also most of the measles-related deaths. And today it affects basically all states in the country. So besides illegal mining, the circulation of measles in Venezuela, we can say, was also preceded by a progressive interruption of the national immunization program, which happened pretty much since 2010. And also, along with the dismantling of the primary healthcare infrastructure. So if we closely examine the numbers, we know that the national coverage rates for the second dose of the measles vaccine was estimated in 52%. And those were as per the last reports from the Venezuelan Ministry of Health, which are official reports, which are largely unavailable, not to say unavailable. Mm-hmm. So 52%, an official number, and this estimate ranks Venezuela toward the bottom of the vaccination coverage in the region. And this is much worse as you go to isolated rural areas like the indigenous populations. For example, the Amazon, which is being hit tremendously with illegal mining activity, current estimates of measles vaccination coverage in the Amazon region have basically decreased throughout all municipalities. Where the gold mining activity is located, basically, is where the lowest coverage is achieved. So this is notably affecting the Venezuela-Brazilian border, where actually current measles outbreak is sadly threatening to decimate the ancestral Aboriginal Yanomami people who inhabit the highlands of Parima in the Amazon state.
So with measles spilling over, particularly in Brazil, we at the website we keep a really close eye on what's going on down there, and Brazil has seen thousands of cases, all from Venezuela, basically. What is Brazil? What do they have to say about this?
Absolutely. We'll talk about this later, but we closely work with collaborators in the Fiocruz in Instituto Valdo Cruz in Manaus, and we closely follow up on these numbers. And as you mentioned, absolutely, emigration from Venezuela has substantially affected Brazil, but not only Brazil, Colombia, and other countries in the region, such as Ecuador and Peru. So measles cases imported from Venezuela have been reported throughout the Andean region. And this is basically because of cross-border mobility, migration, and in down south, what pertains specifically to Brazil is the illegal mining activities that have been the main sources of disease spread in the south. And you're right, thus far, Brazil has reported most of the important measles cases, mainly from the state of Bolívar, where the Orinoco mining arc is actually ongoing, and where the major measles outbreak is taking place since its initial emergence. And we are close to almost 4,000 cases in all neighboring states of Brazil, meaning Roraima and Amazonas, with approximately up to 7,000 cases under investigation. Of the totality of the cases reported by Brazil's Ministry of Health in the state of Roraima, just for a number, through May 2018, 68% of the measles cases actually were reported from refugees from Venezuela. And what is most interesting is that of the 68%, 52.7% were patients from an Amerindian tribe called the Waraos. And the Waraos are Amerindian that inhabit the Orinoco Delta, which is, quite distant from Bolívar. What is happening is that the humanitarian crisis has hit so hard in the Orinoco Delta that the Waraos are migrating down south to the mines and then to Brazil. So it's become a cultural crisis as well for our Amerindian tribes in Venezuela. The Colombian Ministry of Health has also reported close to 30 imported cases, measles cases from Venezuela. In Ecuador as well, we got to take into consideration that the Rumichaca International Bridge, which actually connects Colombia and Ecuador, basically has seen 286,000 persons which have crossed that bridge. So up to now, there have been close to 700 suspected cases in Ecuador, with close to somewhere around 15-20 confirmed cases. Also, the Peruvian Ministry of Health has reported imported cases from Venezuela. Last number I was managing was 2. That probably is a higher number right now.
So, Dr. Paniz-Mondolfi, if you were down there and have a child today in Venezuela, even if you had the money, can you get the children vaccinated? I mean, is there an availability of it?
This is erratic because the public health system is basically in decay. So, months before the measles and diphtheria kicked in, it was basically impossible to access vaccination in the public health system. You could, with luck, access the vaccines in the private health system. However, these vaccines were sold at international prices. With a country that is undergoing a currency exchange control and in which you only had access to dollars in the black market. So we are talking on the 100-fold value of what the supposed legal exchange rate is in the market. So basically, the bottom line here is that for most Venezuelans, including a doctor like me, paying for your child's vaccinations in dollars was basically impossible. So yeah, and to complement this, Robert, again, it's not only vaccines. It's been long. We've confronted long-term shortages of essential medicines, medical supplies, and of course, this impacted very much the market in biologicals like vaccines. And you have to add not only the access to vaccines, but the crumbling healthcare infrastructure, which basically led over the last years to an interruption and weakening of the national immunization programs.